Hello and good morning. Welcome to our Saturday live health lessons. Hopefully you're having a great morning. On behalf of the American Heart Association, I would like to thank you for joining us today. I'm Francesca Martinez, the National Health Equity Manager for the American Heart Association, and I am delighted to be hosting this live virtual health lesson. So before we begin, we would like to take a quick little moment of silence for gratitude and prayer. For many faiths this week, it is extremely significant. Those who are celebrating Passover, Easter, and Ramadan later this month. And so with many faiths represented here today, we want everyone to take a quick moment of silence and pause. Again, we hope you and your families are safe and healthy, and we are so grateful you've joined us. So thank you again for being here this morning. As we all know, we are in an unprecedented time. The coronavirus, or COVID-19 as it's called, is impacting everyone regardless of race, religion, age, or gender. And we want to assure you that the American Heart Association is dedicated to the health and well-being of all individuals and their families in every community everywhere. Not just today, but going forward into our future and whatever lies ahead. We want you to ask questions, as we mentioned. So as you listen to today's lesson, feel free to drop your questions into the chat box. We will have a Q&A at the end. Now more than ever, people are turning to their faith and places of community for help and hope as everyone shelters in place and we get used to our new normal. Our mission of the American Heart Association is to be a relentless force for a world of longer and healthier lives, and that is more important than ever. The American Heart Association is deeply concerned about the public health crisis facing our country. And our top priority during COVID-19 is the health and well-being of individuals and their families today and going forward, again, in every community, everywhere. Now, during this time, AHA is continuing our mission-critical work in these challenging times. And we know that people with cardiovascular diseases are more likely to be seriously impacted by the virus, which is why today's topic is so important. Now, I am very excited to introduce our speaker for today's topic. Nurse Alice Benjamin is a board-certified cardiac clinical nurse specialist and emergency room nurse specializing in critical and emergency medicine with over 22 years of experience, and is affectionately known as America's favorite nurse for her community health outreach and reoccurring health expert media presence. She's been a longtime ambassador, community leader, and health advocate for the American Heart Association and AARP, is a college nursing professor at Charles Drew University in Los Angeles, is a television medical correspondent for NBC, and has made appearances on Dr. Oz, The Doctors, Dr. Drew, Fox, CNN, HLN, TV1, BBC, and KTLA, and is the host of the weekly health and wellness podcast, Ask Nurse Alice. She can be found on Twitter and Instagram at Ask Nurse Alice, and her website is www.asknursealice.com. So as we begin, join me in welcoming Nurse Alice.
Okay, Francesca. So do I take it from here? I'm going to take it from here, right?
Yes, take it
Fabulous.
from here.
So, and thank you for that warm greeting, and thank you to everyone who's joining the call. I'm seeing the people sign in and telling us where you're from. Wonderful. That's great. And I'm going to go ahead and share my screen. All right. So again, everyone, thank you so much for joining us. We are very delighted that you are sharing your precious Saturday morning hours with us for some wonderful information that's going to hopefully keep you, your friends, and your loved ones' heart healthy. I've been a longtime volunteer with the American Heart Association, and I have to say I am absolutely delighted to be a part of this and to share this information with you. And this morning, we are going to be going over learning the warning signs of a heart attack. As we begin, I just want to give everyone kind of a heads up and agenda for our programming today. I'm roughly going to go over about 30 minutes of wonderful content. And at the end, we're going to definitely get to your questions because we want everyone to feel heard and we want everyone to walk away from this presentation with lots of information and to really truly feel empowered. Again, our health lesson for today is going to be learn the warning signs of a heart attack. So this is very, very important. We want you to learn the warning signs and causes. We want to make sure that you don't wait or hesitate to call 911. And we are going to introduce to you, if you're not already familiar with American Heart Association's Life Simple Sevens. these life simple sevens will definitely help to reduce your risk for having a heart attack. And towards the end, we're going to have a closing. We're going to wrap things up. We're going to get your questions answered, address your comments. I know there's lots of questions going on, especially in this climate of coronavirus and COVID-19 and who's at higher risk with heart disease. And we're also going to share some wonderful online resources and let you know where you can find this presentation at a later time. So you can watch it again, you can share it with your loved ones, your friends, your neighbors, folks at church and at work, because again, this is definitely important information that we're going to want you to share. All right, so let's begin with what is empowered to serve. And this is one of those moments where, you know, you don't like to really reveal your age. Not that I'm revealing my age, but I have been working with the American Heart Association for over 10 years. And I remember this actually used to be a program called Power to End Stroke, I believe, but the word power was in there, and it's transitioned over time to become empowered to serve. And that's exactly what it means. We want you, the consumers, the community members, you know, the parents, the daughters, we want you all to feel empowered to know this very important information. And Empowered to Serve is a movement that inspires those who are passionate about driving change through health justice in their community. So we all, you don't have to be a nurse, you don't have to be a doctor. Everyone is just as important in this. We're all in this together, and we can all serve as catalysts for change, empowering the equity equation. And so one of the mission statement at American Heart Association is to be a relentless force for a world of longer, healthier lives. And that's exactly what we want everyone to do. We want you all to live happier and healthier lives. And just my personal story real quick before we move on is one of the reasons why I was drawn to the American Heart Association and why I've been a member, an ambassador and volunteer for so long is I lost my dad to a massive heart attack in the hospital. And this was several years ago as I was still going to nursing school. And growing up in an underserved community, I saw not only my father, but other people in the neighborhood, other family members of my friends, and I could see how we didn't necessarily have the resources, the education, the community outreach, which could have made a big difference in how we lived our lives. And so when my dad passed away from a massive heart attack, I decided while I was in nursing school that I was going to be the best cardiac nurse in the world and take our experience and hopefully educate and outreach in the community so people wouldn't have to go through what we went through, because a little bit of information goes a very, very long way. And that's what we're hoping to accomplish today. We want you to learn about the signs and symptoms of a heart attack, everything that you can possibly learn. So I don't know if anyone is aware, but about every 40 seconds, an American has a heart attack. So let's just count down 40 seconds and see what that sounds, what that is. So that was 40 seconds. So it's very unfortunate that every 40 seconds, someone's having a heart attack. And while we can't predict the future, there are definitely things that we can do, we can put in place, and we can educate ourselves to decrease our risks of having a heart attack. And then also knowing that if someone were to have a heart attack, there are things that we can do right away that can hopefully decrease the severity of the heart attack. And that's what we're going to get into this morning. And again, if you have questions, please pop those in the chat box. We want to make sure we answer all of your questions. Now, I know that seems like a grim slide that I just previously shared, but here's the good news. Here's the good news. Although there are a lot of people that have heart attacks, every year thousands and thousands of Americans can survive a heart attack and go back to work and enjoy a normal life. And the way, and to do that, very few simple things. We want you to be educated, we want you to be informed, and we want you to definitely take action. And some of those actions, you know, we get stifled, we get scared, we don't call 911. So a lot of simple things. But again, we are here to, we want you to feel empowered. So we're going to provide you some information with things that you can do. Because when you have a heart attack, one of the key things is to recognize the signs and symptoms that you may be having a heart attack, and to get help right away, to call 911. So some of our program objectives for today, by the end of this lesson, and we want you to definitely share this with your family and friends. We want you to know the signs and symptoms of a heart attack so you can get help right away. Sometimes heart attacks can be sudden and intense, and sometimes they can be very slow in onset and kind of have more of a nagging feeling. And we're going to go over those things. But the most important things is that you recognize that something's wrong, something doesn't feel right, and that you call 911 and you get help. And acting quickly can definitely help save as many lives as possible. And it might not always be you calling, having the heart attack. It might be someone else. So again, very important that you recognize this in someone else so you can get someone else help as well. All right. So we've heard this many times before, but if you haven't, heart disease is the #1 killer in all Americans. But we know that there are some groups of people who are disproportionately affected by heart disease. And as you can see from this slide here, it's generally people of color. And there are reasons for that. There are social determinants of health. Sometimes people of color live in communities where there aren't access to as many fresh fruits and vegetables. It may not be as safe outside to exercise. They may not have access to quality health care. So a variety of reasons, but by looking at this slide, you can see that African Americans, 1 out of 4 die from heart disease. Our American Indians and Alaskan Natives, 1 out of 6, and Latinos die from heart disease, 1 out of 5. Now, again, heart disease impacts everyone, but because we know that there are social, economic, and educational factors that predispose people of color to heart disease, it's going to be even more important that you stay informed, you stay educated, and you take action when it comes to not only your heart health, but to the heart health of your friends, family, and loved ones as well. Okay, so learning the warning signs and causes of heart attack. So you can see the gentleman in this picture, he's kind of grasping his chest. And for some people, the warning signs can either be all of these things or just some of these things. So the key thing is, if you have any of these symptoms, we rather you err on the side of caution and get help to make sure that that you're not having a heart attack. So some of these feelings, you can feel a very uncomfortable pressure or squeezing in your chest. I've had people describe it as they feel like they have a belt wrapped around their chest, or there's an elephant sitting on their chest. It can last more than a few minutes. And there are times where this pain comes and then it kind of goes away. So it waxes and wanes. Some people also report feeling pain and discomfort in one or both of their arms, the back, neck, jaw, or stomach. So this is the case, I will say, in practice, we generally see that this discomfort is more so on the left side. Your heart is on the left side of your body, so that's generally where we see it. But if it's happening on your right, we want you to come in so we can help determine if this is a heart attack or not, because we want to err on the side of safety. People will also feel some shortness of breath with or without the chest discomfort. And I'll just say that shortness of breath is something you should always explore regardless of what may be causing it. And then you might feel like you're breaking out in a cold sweat and have this nauseous, lightheaded feeling. So again, if you're having any of these, even just 1 or 2, or all of them, it's going to be very important that you recognize that these might be signs that someone is having a heart attack. Now, women, I like to think we're very special, and we are. But women, I want to say that sometimes we present differently. And in the research they'll definitely show that women often present differently with these symptoms. They're more general. So oftentimes this type of diagnosis is missed. But that's why we want you to feel empowered and for you to be educated, so you can say, if you go in and you're having these symptoms and someone says, oh, well, maybe you're just, anxious, you're just having upset stomach, say, no, I think I might be having a heart attack. Please just make sure. So it's okay to say that. And I'm saying that because although I'm a health professional and I will always do everything for you, there are times where different clinicians might come to suspect different things. And that's where you, as the patient, the person, the family member, we want you to say, you know what, I think my mom might be having a heart attack. Could you please do a workup? So, because these symptoms are very general. Shortness of breath, nausea, vomiting. Women, and especially women of childbearing ages, we can have nausea and vomiting, even just kind of with our cycle and just other things. Our hormones can cause these things. Pressure in your lower chest or abdomen, your jaw, your neck, upper back pain, dizziness, lightheadedness, and extreme fatigue. So this kind of sounds like almost every day. If you're, working, have children, have, responsibilities, these can be things that you might feel like you're feeling on an everyday basis, but that's why it can be considered as very general. But again, if you're having these things, you need to explore why you're having them. And we always want to make sure that we've ruled out that you're not having a heart attack. Again, women may experience a heart attack without having any chest pressure. And these might be the signs and symptoms that you're experiencing. So we want you to stay informed. Now, what causes a heart attack? This is a question that people, always want to know, because they want to prevent from having a heart attack. And I will say this. Your heart is responsible for pumping blood out to all of the major organs of your body. Your heart is what keeps oxygen-rich blood flowing. Now, your heart has a big job supplying everyone else. Well, it needs its oxygen-rich blood too. So if you can see on the slide here, and I won't get too much into science class, guys, but this is your heart, right? So it's not that nice red heart shape that we see on Valentine's Day. It's actually shaped almost like your fist, and it's roughly about the size of your fist. And you can see that there are arteries overlying your heart. So these arteries are what bring oxygen-rich blood to your heart. So as your heart pumps blood to everyone else, it needs its share too, so it can keep doing its job. And so what will happen is during a heart attack, there can be blockages or the buildup of plaque in these arteries that can decrease the amount of oxygen-rich blood going to a certain area of your heart. And then when your heart is deprived of oxygen-rich blood, then that's when the tissues begin to become what we call ischemic. That means they're not getting enough oxygen-rich blood. It's kind of like you have a car with no gas. It can't go anywhere. So when your heart's not getting oxygen-rich blood, it can't pump. And that's what causes a heart attack. Now, there are certain things that we do, activities, lifestyles, changes, other aspects of our health that can influence how healthy those coronary arteries will stay. And we definitely want to do those things, because what we're trying to do is to slow down a process called atherosclerosis. And that is the buildup of plaque in those arteries. And other things like to not smoke, because we know that smoking can cause clots. And we just want to do everything possible to prevent any type of plaque buildup or any clots happening in those very important arteries, so our heart can get oxygen-rich blood. Okay. So another question that I get a lot is it a heart attack or a cardiac arrest? So these are two different problems, but sometimes they're used interchangeably. So it's important that you stay informed. So a heart attack is a circulation problem. So remember, not enough oxygen-rich blood flowing through those arteries to get to your heart. And then when your heart can't get that, it creates problems. So a heart attack is a blood flow problem. A cardiac arrest is an electrical problem. So what I didn't mention on that previous slide is that our heart kind of has its own electrical system built in, and that's what helps it to pump. And so when your heart has irregular beats or begins to malfunction and it has a problem in its electrical system, then the heart just stops beating. Okay, there might not be an issue with circulation, but the electrical part stops. Okay, so we're in today's programming, we're focusing more so on what is a heart attack. But it's very important that you know the difference. And then also, if you can do the things to prevent yourself from having a heart attack, then you can likely prevent yourself from having a cardiac arrest. Because whenever our heart has a lack of oxygen-rich blood to it, which causes the heart attack, if that stays in that state and it's not remedied or it doesn't reverse itself, it can eventually lead to a cardiac arrest, which is the sensation of it pumping. Okay. And this wonderful resource here on the side, Francesca and American Heart folks we're going to let you know where you can get that at the end, so you can have that and share that with your family. So we're going to learn the signs of a cardiac arrest. Cardiac arrest, as I mentioned, is an electrical problem, right? So these are things where you're definitely going to want to call 911. Sudden loss of responsiveness. Whenever you find someone who's not responding to you, you're tapping them on the shoulder like, hey, Alice, are you okay? Are you okay? And they're not moving, they're not speaking, they're not blinking, they're basically not responding or being their normal self, you got to call 911. If someone's not breathing normally, maybe you hear them kind of gasping for air, or you notice that, any type of changes in their breathing, actually, whether it's very, very slow, very, very fast, or just making weird sounds. Also, something very important, you want to call 911. And I'll say this, time, in the medical field, we say time is tissue. And it doesn't even have to be in the medical field. You can say it yourself, time is tissue. The sooner you recognize someone is having problems with responsiveness, with breathing, or even the signs and symptoms of a heart attack from earlier, you'll want to call 911, because we want to get that person to a medical center where they can be treated and get taken care of right away. Oh, and I jumped right into it. When someone's not responding to you, when they're having problems breathing, what do? You call 911. Do not hesitate. Call 911. Okay, guys, it's going to be very important. And if you're with the person, as someone else is around you, you tell someone, hey, Francesca, call 911 while you tend to the person that's in front of you. Something that's important also, and not everyone feels comfortable with this, but I think they don't feel comfortable because they just are unfamiliar with it. So I want you to take this time. Many of us are staying home right now. It's going to be very important to learn these things. CPR. CPR is going to be one of the most critical things that you can do to help save someone's life, guys. If someone's found down, not responsive, their heart very well could have gone into cardiac arrest. And so if their heart's not beating, the tissue cells in the body are dying. We need to get circulation. And the best way to do that is for you to do CPR. Okay, you're going to push hard and push fast in the center of the chest. And by doing that, you are actually temporarily functioning as that person's heart. So by doing CPR, you can save someone's life. And whoever calls 911 should stay on the phone with the dispatcher until someone arrives. I've been with people who've called 911, and it's going to be very important. They're going to have instructions. They might be looking for where you are. So stay on the phone so you can guide, tell the dispatcher what's going on, because they might have further instructions for you. And then also, as the paramedics are on their way, they might need instructions with how to get to you. Point number 2, and I think I've kind of beaten this throughout all of the slides, but again, I can't emphasize how important it is to call 911, because every single minute matters. Fast action can save lives. And it's very important that you call 911, because when you do that, it will bring medically trained staff and personnel to you, and whether it's you that needs the attention, or a friend, a loved one, or a bypasser that needs the attention. And that's going to be critical, because you're bringing medical staff who are trained to do 911, who can put in IVs, who can do EKGs, who can administer medications, and do all the things that that the individual may need. You as I know some people are like, oh, I can get to the hospital faster in my car. Well, you're driving the car. What if your friend or your family member, your loved one needs oxygen? There's definitely treatments that our paramedics and our trained first responders can provide. So you want to call 911. And as well, they will be able to take you to the closest facility that's best suited to take care of your loved ones. So now, while all hospitals can provide wonderful care, there are definitely certain hospitals that have additional or extra services. We call them STEMI centers or cardiac centers that have extra personnel on staff 24/7 to handle these type of emergency needs. So again, very important to call 911. Now, not everyone's going to call 911 right away, and it's because they're worried about doing so. And I'll tell you this, never feel worried, never feel ashamed about calling 911. Okay, again, time is tissue, and what you're doing by calling 911 is trying to get important medical attention to people who need it. Now, some of the reasons people might feel embarrassed is because they're worried about a false alarm. Now listen, I would so much rather you call and it be a false alarm than you not call and someone potentially die. So we want to take actions, be a good citizen, be a good family member, err on the side of safety and do everything that you can. And others might also feel afraid that they're actually having a heart attack. So this is this kind of sense of denial. Those are valid feelings to feel that way, but I would much rather you take the action so you can live another day to then talk about it. Okay, so please do not hesitate to call 911. I'll tell you a little short story, and I'll promise I'm not going to go over too much time, Francesca, but I remember my dad, and actually he was having a stroke at this time. He was having a stroke, and he's like, Alice Lee, you better not call 911. Yet I saw the visual signs of him having a stroke, the one-sided droopiness, that he was drooling, a bunch of things. And my dad said not to call 911. And I said, although I'm a great daughter, I thought, you know what? No, Dad, I love you too much. I want you to stick around. So I called 911 and we got him to the hospital. And very much so, because the hospital I had in mind at the time was not a stroke center, and where the paramedics took him was a stroke center. So trust that the paramedics are going to take you to the hospital best suited for your needs. Now, here's another concern about calling 911. How much does it cost? Will I get in trouble? Do I need an ID card for emergency? And the answer is no, absolutely not. When you call 911, that is a kind of a bat signal to get people to you to just help you. They're not going to ask you anything. We're not going to ask anything about what kind of insurance do you have, any of those things. Their primary concern, our primary concern, is that the person who is having symptoms is getting treated. So don't worry about all of these things paying up front. Listen, your life, your grandma's life, your neighbor's life is so much more important than worrying about these things. Okay, so please do not hesitate to call 911. Okay, so steps that you can take today. So before there's an emergency, right? So the best defense, or excuse me, the best offense is an even better defense. So getting ready. And what we've learned with all of this coronavirus and COVID-19 is that we weren't quite as prepared. Some of us didn't have food stock. We didn't have, all the emergency items that we needed. So we were left scrambling. So in situations like this, we want you to be best prepared. So we've already gone over some of the signs and symptoms of a heart attack. So you know those things. We want you to find out which hospitals in your area have a 24-hour emergency cardiac care. So I mentioned those to you. There are definitely cardiac centers. While all hospitals can be of some assistance, if you're having a heart attack, there are definitely medical facilities designated to provide state-of-the-art advanced services 24/7. They keep physicians on call, they keep nursing staff on call, certain protocols, medications, and treatments that they can implement right away as soon as you get into the emergency room. And while we're at home on stay-home orders, I think that's an activity that everyone can do as a family. Get together, talk about, share this lesson about what are the signs and symptoms of a heart attack, and what would you do? Call 911, and then knowing what those emergency services places are. And I'll say that some paramedics will ask, do you have a preferred hospital? And if you know where your cardiac hospital is, maybe a family member can say, hey, we want to go to, X hospital or A hospital. Then always remember, you should call 911 in emergency in any situation. When someone's not responsive, they're not breathing normally, they're grasping for breath, or they're having any signs of those chest pain or heart attack symptoms that we talked about earlier. Now, how can we help reduce your risk for having a heart attack? Well, the American Heart Association has a lovely program called Life's Simple 7. 7 simple things that you can do to help reduce your risk of having a heart attack or a cardiac event. So it's getting active. We want you to exercise. Exercise for at least 30 minutes, 5 times a day. Nurse Alice, we're at home. I can't get to the gym. Well, you can exercise in your living room. Everyone's on social media, Facebook, there's YouTube. You can find an exercise video and get moving. You can grab some cans in your kitchen and start exercising. You can, take some resistance bands and start stretching, do some squats, something to get you active, or even walk around the perimeter of your house, obviously wearing a mask and with social distancing in mind, provided it's safe. Also, eating better. You want to choose foods that are low in fat, trans fat, cholesterol, and salt. So this is not the time to be eating chips and, lots of top ramen and things like that. Now, mind you, in a state of emergency, sometimes you got to eat what you got to eat. But for the long run, for the most part, we want you to make healthier food choices, more fresh fruits and vegetables. And if many of us are stay home, I actually started a garden in my backyard because I want to eat more fresh fruits and vegetables. And in a state of emergency, it's great to have a garden. Losing weight, keeping your weight under control. When you have extra weight on board, your heart has to work a lot harder, and it puts you at higher risk for having other complications like diabetes and other things that can increase your risk for heart attack. So losing weight is going to be very important. Stop smoking, okay? You want to stop smoking because that's going to be very hard on your lungs, which can then be hard on your heart. And you also want to avoid secondhand smoking. So this is the perfect time to avoid any type of tobacco smoke. You'll also want to get your cholesterol checked, knowing what your cholesterol levels are. Now, there's a total cholesterol, there's good cholesterol, there's bad cholesterol, there's triglycerides, all of those things. You'll want to go to your healthcare provider at the next convenient and safest time to do so if you haven't been, and make sure you know what your cholesterol numbers are, and talk to your provider about what should my target goals be. But keeping that under control is definitely going to help decrease the buildup of plaque in your arteries. Having your blood pressure under control. So having a nice heart healthy blood pressure. And according to the American Heart Association and other agencies, having a goal for our blood pressure would be 120/80 and below. And when we get above that, that's when we get into pre-hypertension and stage 1 and 2, high blood pressure. But talk to your healthcare provider with what your blood pressure goal should be, because when you can treat high blood pressure, then you can decrease your risk of having complications from it. And then also reducing your blood sugar. So we know that diabetes is a risk factor for having heart disease. When it's very important that if you're diabetic, pre-diabetic, or even have diabetes in your family, that you're very, very diligent about watching what your blood sugar levels are, because we know having high blood sugars, that means you have a lot of glucose in your blood, can make your blood very thick, and it can help influence blood circulation. And remember, heart attacks, it's a circulation problem. We want to do everything we can to decrease your risk from having a heart attack. And one of the important thing in that is also managing your blood sugar. So call to action, these are the things that we want you to do. We're definitely wanting you to learn the warning signs of a heart attack and a cardiac arrest, which we went over previously. If someone is having signs and symptoms of a heart attack or cardiac arrest, they're unresponsive, problems breathing, call 911, guys. Do not hesitate. Call 911. Don't be afraid of anything. Call. And we want you to embrace the Life Simple 7s to reduce your risk of heart disease. Those things that we just went over in that previous slide. Now, as we're getting near the end of the presentation, we've went over lots of information about things that you can do to help reduce your risk. We also know that things need to change within our communities and at higher levels, state, national levels. And we really want to encourage people like yourselves who've been on this call to really make sure that your voice is heard, because your voice matters. And we'd like to invite you to join You're the Cure today and be among the first to know whenever there's major policy initiatives to pass, or when your help is needed to really advocate at state and national levels to put laws and regulations and things in place so we can have a healthier community. So if everyone on the call could please text EmPOWER to 46839 and join today. Encourage your family members to do it as well. And this isn't something for, or I should say, this is something that, high school kids, elderly, seniors, anyone can be a part of this. It's really, really important that we take actions, not only personally in our day-to-day lives, but to also impact our communities that we serve. And so we want to make sure we make this place a healthier and safer place for generations to come. So you can help us work to draw communities together and on a path to building a sustainable culture. We want you to please visit the website empoweredtoserve.org and sign up to be an ambassador. You know, American Heart Association, I have been volunteering for over 10 years. I absolutely love this organization, what it's done for communities, what it's done at the national level, state level. And, you know, it's been a great community because working with the American Heart Association and Empowered to Serve, there's, you know, not only could you help by giving your time, but they definitely give back to the community and help put systems and processes in place and do a lot of outreach and education to make sure that you are living your healthiest life. So pay it forward and become an ambassador and learn how you can be a part of a movement. Because like we said before, everyone plays a role in the health of our communities. So we're going to wrap things up here. Gosh, I feel like where's the time gone? I know it might seem like to you that I've talked a lot, but I really could talk about this all day. I absolutely love being a nurse. I love being a volunteer with the American Heart Association and getting important information like this out to others and rallying them up to help, you know, educate and train other people as well. It takes a village. And so we really, really appreciate your thoughts. We want you to tell us what you like the best and maybe what you didn't like so much. I'm okay, I can take it. I'm a tough cookie. And then email those comments to empoweredtoserve@heart.org. And we want to do this again, and we want to do it better, and we want to make sure we're meeting your needs and answering your questions. If there's something specific to your communities, you know, we want to hear it because we want to support you so you can live a happier and healthier life and help others in your community and at the state level and national level live happier and healthier lives. Again, heart disease is a leading cause of death, and it doesn't have to be if we can take the actions and do things to change that. So with that, I am, Empowered to Serve. One more slide here. So again, thank you very much for being a part of this presentation. Please, it's been my pleasure to serve you, and I'm hoping that you will make the decision to become an ambassador and to serve others as well.
It started out like a totally normal day. Mom! Okay, move objection deadline to the third line after survey. Oh, honey, for when you always use the verb start. What are you doing down there? Did you finish your breakfast? Ow. Whew. Don't hit your brother. Honey, you have to eat something. Here. Okay, 5 minutes to carpool. Where's my coffee?
You okay, Mom?
Oh, I'm fine. Sandwich orders. What do you want?
Almond butter and jelly.
Spaghetti.
You sure you're okay?
I'm fine, sweetie.
I am so late. Hey, buddy, how you doing? Hey, honey. You okay?
Yeah, I'm fine.
You sure?
Oh, yeah. Here.
Acai, my favorite. See you guys later.
Wear your shoes. Put your shoes back on, please. You know, go help your sister. We're going in 3 minutes. Oh my God, what am I doing? I forgot to cut off the crust. Voila. Shoes on, potty if you need it. Honey, get your sister. Okay, get her. Nobody move. I'm getting a dustpan. Oh.
Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? I'm just gonna sit down. I'm totally fine. Don't forget to wear the high socks with the shin guards.
Forget about the shin guards, Mom.
Come on, Mrs. Underdog is not gonna wait. Whoa. Okay. 9, 1, 1. Hi, sorry to bother you. I think I might be having a little heart attack. Nothing really, just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest. Oh, really? They can be here in how long? 2 minutes. Can you make it 10? I thought I had gas. Turns out I was having a heart attack. Heart disease is the #1 killer of American women. So now I take care of my heart and I tell the women in my life to do the same.
Sounds great, by the way.
That's nice, sweetie, but that's not my heart. that is. Make it your mission to save your life and the lives of the women you love. Find out more from the American Heart Association at goredforwomen.org.
So let's go ahead and get the questions started. One of the important questions, especially during this time, some have been told, during COVID-19, maybe don't call 911 or go to the emergency room. What do you suggest? Maybe also, maybe people are apprehensive about going to the hospital during this time. So how do you answer that, or how do you still encourage us to make sure that we are taking those steps and those actions?
Right, so that's a great question, and thank you to probably the many people that asked that question. We are in a state of COVID-19. Coronavirus has definitely changed the landscape, and the emergency rooms, going to the emergency room at this time could potentially put you at risk for contracting the coronavirus. We will agree with that. Hospitals are trying their best to protect people, but I will say this: if you are having chest pain, or let me back up. If someone's unresponsive, having the problems breathing, right, the gasping of breath, or they're exhibiting any signs of a heart attack, it's still going to be very important that you call 911. Okay, the paramedics that will respond to you are aware of what's going on with COVID-19. Again, we're doing everything. I'm on the front lines. I work in the emergency room. We are doing everything we can to keep people safe. But again, if you're having a heart attack, I need to keep you, I need to get you in there. I need to get you on the monitor, oxygen. We got to check some blood work. We got to get you perhaps medication. So please don't hesitate. I know we're all afraid of the coronavirus, but if you're having a heart attack, I'm going to say the heart attack trumps the coronavirus right now, meaning I need to address that very acute need right now. Something's happening right now. Like I mentioned, time is tissue. The longer you wait, the potential for permanent damage to occur to your heart. And we want to prevent that, okay? So if anyone's having symptoms, call 911 and the paramedics will assess you on the scene. They can even initiate treatment. And then if need be and they need to transport you to a hospital, they'll do so safely, and to a cardiac center, might I add, for your specific need. So I know coronavirus is making it very scary, but please, if you're having a heart attack or cardiac arrest or believe someone else is, call 911.
Awesome, thank you. So CPR, we talked about CPR, and we know that in our communities, we know the statistics, right? That communities of color receive less bystander CPR. Men of color specifically can even receive 50% less bystander CPR, but there's still some apprehension, right, about CPR. And we have compression only CPR. Now there's a question that for some, they're apprehensive that maybe if they don't have a CPR certification, right, and they do perform CPR, that they may be prosecuted or sued. Is that true?
Right. So there's what's called the Good Samaritan law. Now, I will encourage everyone, because everyone's checking in nationally, to review that in your particular state. But for the most part, there's what's called the Good Samaritan law, where if someone is found down, unresponsive, and you are someone who's walking by and you believe that person needs help and could benefit from CPR, to go ahead and initiate CPR. Because again, guys, when someone's found down, they're not responsive, our biggest concern, because we can't see, because they're not on a cardiac monitor, is that their heart has stopped. When your heart is stopped, there's no oxygen-rich blood going to important organs like your brain, your kidney, your lungs. So, and it might sound pretty bad, but it's true. When your heart stops beating, your tissues start dying. Your cells are dying. So by you initiating CPR, you can save that person's life, and for the most part are protected by the Good Samaritan law. It's rather to do CPR and it not be needed than to not do it and it be needed, and then someone unfortunately die from that.
Thank you. So yes, definitely check any state laws, but we are covered, under the Good Samaritan law. Another question: what if a person is experiencing chest pain that comes and goes, but no difficulty breathing? Could that person be having a mild heart attack?
They could, and I think, and we looked at, if you guys will go back to the slide and when you get an opportunity, or look on the website, Life Simple 7 is going to be very important. So what we do as healthcare professionals is when someone's complaining of chest discomfort, we look for risk factors. And what do we know about risk factors? We know that people of color are higher risk for heart disease. We know that people who have diabetes, high cholesterol, who are overweight, those that smoke are definitely at a higher, and if there's family history, are at higher risk for having heart attacks. So we look at those things, but we definitely need to do more of a workup, right? So we'll need to look at some labs and do some tests and things like that. But if you're someone who meets those criteria, and you know you have high cholesterol, you know you have diabetes, African American male, it runs in your family, and you're having some chest discomfort, I'm going to encourage you to please, please, please get that evaluated. You know, go to your healthcare provider if it's, you know, it's something it's very it's a new onset. You're like, oh my God, like you wake up out of your sleep, you're having this chest pain. I'm going to say call 911 because you have risk factors. Just because you don't have lab or test results in your hand doesn't mean that, oh, I can't call 911 because I haven't seen my primary doctor first. If you have a general suspicion that you could have these things and you're having chest pain, by all means, call 911 and get some help.
Thank you. So what are some tips that we can keep ourselves safe, right? We have to still go out and get groceries or, you know, go to the pharmacy. You know, how can we keep ourselves safe, especially if we have underlying conditions, i.e. high blood pressure, cholesterol, or diabetes? So what are those tips that we can keep ourselves safe and others safe from us, you know, if we're not showing any signs and symptoms during this time of COVID-19?
Right. So the big discussion is, you know, certain people are at higher risk with this coronavirus. And so and just to say, clarify that people who have pre-existing conditions are at higher risk for worse complications of this coronavirus. Everyone is susceptible to coronavirus. Everyone can get it. But if you have pre-existing conditions, if you get it, your complications are at higher risk for being worse. So that's why we really want to protect you. So for anyone who has pre-existing conditions and you want to stay safe during coronavirus, by all means, stay home. Okay, you want to stay home, is not venture out if not necessary. It's going to be very important that you do frequent hand washing, good hand washing, rubbing all surfaces of your hand for at least 20 seconds with soapy water. And if you don't have that, you can use hand sanitizer. Making sure that you clean commonly used surfaces often. So the door handles, especially coming in and out the front door, anything that's being touched frequently, you'll want to clean those surfaces down. If you do need to venture out, you should be wearing a mask. Now, I know everyone's like, the N95 masks and most of the surgical masks are being reserved for healthcare professionals, but it's better to have something than nothing. You can take a band. I'm looking around. I actually made this. So just take, if some of y'all got sewing skills, take a t-shirt, some bandanas. These are just elastics from my hairband. Get a bandana, get a scarf, but you definitely want to cover your nose and mouth when you go out. Social distancing, staying 6 feet away from each other. And the reason being is because when someone's talking, laughing, coughing, breathing, and if the wind blows hard enough, that coronavirus can jump up to 6 feet. So that's why 6 feet is important. Do not, and don't go out unless medically necessary. You need to go to the grocery store, and even then, only send one person. The whole family doesn't need to go. And if you're someone, I also want to say this, if you're someone who has wondering, should I go to my medical visit or should I not go to my medical visit? Call your provider on the phone or send them an email. There are telehealth appointments that are happening. I actually just had a telehealth appointment myself, and I got to talk to my provider through the computer and through the phone. And if you're if you can even be talking to your provider and you're complaining about something, they may then direct you to go to urgent care emergency room, but you don't need to leave your home unless absolutely medically necessary or you need to get food. I think I covered a lot there. Yeah.
Yes,
What
you
else?
did.
What else?
Awesome. Thank you. So just going to go ahead and wrap up. So I'm going to give you time for any last words or anything you want to leave us with, and then I'll wrap up and I'll tell everyone kind of next steps.
Yeah. I always love talking about topics like this because I have such a personal story, and I've been a nurse for over 22 years. I've worked in the emergency room, I've worked in the ICU, and I absolutely adore taking care of people. But every time I take care of someone, and I don't know if I mentioned, but I'm actually a cardiac clinical nurse specialist. So I specialize in cardiac health. Every time I take care of someone, there's always a piece of me that wishes that I had more time to talk to them before they'd come to the hospital, because I always talk with them and I talk about the little things that they can do. And sometimes it might seem like, oh, one small little thing is not going to matter. And I have to tell people, if you just take one change out of that whole list of 7, even if you only took one and you made that change every day, which then would result in every week, over months, over years, would make a big, big difference and significantly reduce your risk for heart disease. And if you can reduce your risk for heart disease and your heart is happy, then if your heart is happy, for the most part, it can make other parts of your body very happy and really overall improve your health. And I think that in light of the coronavirus and this COVID-19, people are starting to see how valuable their health and wellness is. And I'm hoping that this is a time of reflection, and that while everyone's at home, that they take the opportunity to have a family conversation about, their health conditions, their risk factors, learning their family history. You don't know how many people don't know their family history or what medications someone in their family is taking, and really take the time to learn about one another in your home, about your health, and make a commitment as a family that we're going to eat healthier, we're going to do activities together, and try to help each other live a happier and healthier life. So that's something that while people are feeling a little restless at home, that I'm encouraging them, learn everyone's medical history, find out what exact medications there are, what allergies they have. Where's that information, writing it down on a piece of paper so it's handy. And so everyone has it, and then make a plan to do things healthy together as family.
Awesome. Well, thank you so much, Nurse Alice. Thank you again. Also, you're on the front lines, like you said, so may you stay safe and well. Thank you for your service and all that you're doing for the community. And thank you again for joining us this Saturday morning. We hope to have you again on some of our future lessons. And so thank you so much. And again, if you would like to check out more information about Nurse Alice, you can head to our website at www.asknursealice.com or follow her on Twitter or Instagram. She has a lot of great videos. I follow her and I repost them, so they're really, really great and practical as well. So again, we thank you all for joining us this morning. Again, this is the first of many in a series of virtual health lessons, again, for us to provide you this information for you and your faith community. So yes, this call is being recorded and it will be available on our empoweredtoserve.org website this week. Also, we would love for you, again, give us any comments or feedback. We're all learning how to communicate and connect virtually, right? Yes. And so this is a new normal, right, for all of us. So please give us your feedback. You can email us at empoweredtoserve@heart.org. We'd love to hear from you. Again, we are going to have another session next week. We're going to be talking about smoke-free communities and why that is so important, especially right now, right, during our current normal, and why, just as Nurse Alice said, we need to stop smoking, but also how vaping is affecting our community. So definitely be on the lookout. Register. You can go to, again, empoweredtoserve.org to register for any upcoming webinars. And again, send us any questions. This recording will be available. And if you have any questions whatsoever, please head to empoweredtoserve.org and all of the information will be there. So we thank you again for joining us this Saturday morning. Hopefully you have a wonderful, safe rest of the day. So stay well, stay healthy, stay home, and take care of yourselves and your family. Thank you so much for joining us, and we'll see you next week.